Hi everyone. I've just run into a lot of people that are really scared about what's going on in BC today. Now, my training is that we have to look at the numbers to see what's really happening. So what I'm going to do is do a little bit of a questioning about what's going on here, but we're going to use the stats that show up on the BC CDC. So let's go to their data and see what's happening. So we go to the BC COVID-19 data, and we're going to go to the dashboard. Now let's have a look and see what the numbers are. So I have some questions on this, and anybody out there is welcome to respond to this, but if you don't question the numbers, you don't have anything to go on. So let's take a look at the numbers here. So they're saying that there is this rash of people getting sick all over the province. And from what I know in looking at this, it doesn't seem to pan out. Maybe I'm reading it wrong, but numbers don't seem to lie. So let's have a look at the numbers and see what's going on. Okay, so we have in our province, we have 161 hospitals. And in the total province of 5 million people, over 5 million people, we have currently hospitalized 367 people. 367 people are hospitalized currently, today. And that's 161 hospitals. How is that overrunning our hospitals? Now, out of those 367, 152 are in critical care. I've been following this for a number of weeks, well, months, and it seems to be quite down from what it usually is. It's usually up around 167, 170, something like that. But it's down quite a bit. So the numbers, and again, this is recent. I don't see, but let's take a look at up north. Let's go to the northern part. Okay, so currently hospitalized in the north, there's 82 people. And there's only 18 in critical care. I think our hospitals are overrun with other things. If we can't handle 18 people in critical care across all of northern BC, I think we have a serious problem with our hospitals. I know that when this whole COVID thing broke out in Ontario, they had a serious problem with their care homes, and that came to light. They actually had to bring the army and the armed forces in to take care of it. Oh my gosh, it was scary how many, what the disaster was going on back there. Maybe we have another disaster in our healthcare system, in our hospital system, and it's only going to get worse because there's certain people who are leaving the hospital care system because they don't want to be vaccinated. And that's up to them. I'm not making a decision on that either way. I'm just looking at the numbers. So let's look at Vancouver Coastal. Okay, so they've got a ton of hospitals, big hospitals. So there's only currently 77 hospitalized in Vancouver Coastal? Well, I thought there was a huge number that was coming down from up north. That number doesn't seem to fit. And in critical care, there's only 29 people? I don't get what's happening here. So, well, let's take a look at Vancouver Island. Okay, so we got currently hospitalized, we got 48 people. And in critical care, there's only 31. Now, there's some dispute whether this is actual COVID cases or COVID-like cases. In other words, upper respiratory, lung-related cases, COPD, those kinds of things. Again, it doesn't delineate here what that is, but let's examine that. We need to look at it. Now, I just want to take a look at this whole cases thing. So let's go to all, and let's look at cases. So they're claiming 667 cases, but we've only got 367 people in all of the province hospitalized. And look at the number of tests, 16,890 tests. Now that test is questionable anyways, depending on the amplification factor you're using. But let's look at what the test rates are and how that compares to what we've been doing before. Well, last year, 13,000 tests. that's in October. Let's go up here. Now we're up to almost 17,000 tests. What are we looking for here? The numbers are down. The numbers are quite down. And that's positive tests. That doesn't mean people are sick. That means a test showed up positive. So I'm a bit confused. Where are all the sick people that they're saying are infecting all of our hospitals and overloading all of our hospitals? If we can't handle 152 in critical care in our whole province, we have got a serious problem with our hospital system. Maybe somebody's misinforming us on how bad our hospital system is. Again, this is just my evaluation. You can have a look at these numbers. Just punch in BC CDC, go to their dashboard, and look at the different areas like the Fraser Valley. Well, they've got a whole pile of people in the hospital, 126. Wow. But there's only 35 in critical care. There's enough hospitals to handle that. I just don't see where the problem is. Let's look at the interior. And they're saying there's a real serious problem in the interior. Currently hospitalized 34. Critical care 39. They can't handle that. That doesn't seem to be a big number. Anyways, I will leave it up to you. You decide what is exactly going on here. I'm just trying to alleviate some people's very serious concerns and being in a huge state of fear around this. Anyways, thanks for having a look at this.